Prostate MRI interpretation and PI-RADS scoring have become integral components in the diagnosis and management of prostate cancer. This technique allows for the accurate assessment of tumor aggressiveness and localization. In recent years, there has been a growing interest in the field of radiomics and radiogenomics in prostate cancer imaging, which aims to extract quantitative data and identify imaging phenotypes that can predict tumor biology and outcomes. Additionally, imaging plays a crucial role in the evaluation of locally advanced prostate cancer, guiding treatment decisions and assessing disease extent. The emergence of imaging-guided focal therapy has revolutionized prostate cancer management, enabling targeted therapies with minimal side effects. This script will explore these topics, along with advanced imaging techniques, molecular imaging, and imaging biomarkers for prostate cancer. Prostate MRI, including T2-weighted imaging, diffusion-weighted imaging, and dynamic contrast-enhanced imaging, allows for the visualization and characterization of prostate lesions. The Prostate Imaging Reporting and Data System, PI-RADS, scoring system provides a standardized approach to interpret MRI findings and assign a score that corresponds to the likelihood of clinically significant prostate cancer. A score of 1 indicates a very low probability, while a score of 5 suggests a high probability of malignancy. Radiologists play a crucial role in accurately scoring lesions and guiding clinical management decisions. Radiomics is an emerging field that involves the extraction of a large number of quantitative imaging features from MRI scans. These features are then analyzed using machine learning algorithms to identify imaging biomarkers that correlate with tumor aggressiveness, treatment response, and patient outcomes. Radiogenomics, on the other hand, explores the association between imaging features and genomic alterations. By integrating radiomics and radiogenomics, we can potentially improve risk stratification, treatment selection, and prognostication in prostate cancer. Imaging plays a crucial role in the evaluation and staging of locally advanced prostate cancer. Multiparametric MRI, combined with other imaging modalities such as positron emission tomography, PET, and computed tomography, CT, allows for accurate tumor localization and assessment of local invasion into adjacent structures. This information is essential for treatment planning, including the consideration of neoadjuvant therapies and the feasibility of surgical resection. Image-guided focal therapy has emerged as a minimally invasive treatment option for localized prostate cancer. By precisely targeting the tumor, while sparing adjacent healthy tissue, focal therapy offers potential benefits in terms of improved oncological outcomes and reduced treatment-related morbidity. Imaging techniques such as MRI and real-time ultrasound guidance are crucial in patient selection, treatment planning, and monitoring treatment response. Advanced prostate cancer imaging encompasses various modalities, including PET imaging with prostate-specific membrane antigen, PSMA, tracers, multiparametric MRI, and diffusion-weighted imaging. These imaging techniques provide valuable information regarding the extent and burden of metastatic disease, helping guide treatment decisions and monitor response to therapy. Additionally, emerging molecular imaging techniques offer potential for targeted therapies and improved patient outcomes. The identification of imaging biomarkers that can predict post-treatment outcomes is an active area of research in prostate cancer imaging. These biomarkers can aid in treatment response assessment, early detection of recurrence, and identification of patients at risk for treatment failure. Imaging features extracted from MRI, such as tumor volume, apparent diffusion coefficient, ADC, values, and dynamic contrast enhancement patterns, have shown promise in predicting treatment outcomes and survival rates. Prostate-specific membrane antigen, PSMA, is a transmembrane protein highly expressed in prostate cancer cells. Molecular imaging techniques, such as PET imaging with PSMA-targeted radiotracers, offer high sensitivity and specificity in detecting primary and metastatic prostate cancer lesions. PSMA PET imaging has emerged as a valuable tool for initial staging, restaging, and evaluating treatment response in prostate cancer patients. Accurate detection and characterization of lymph node metastases are crucial in prostate cancer management. Lymph node imaging techniques, including conventional CT, PET/CT using PSMA or choline tracers, and advanced MRI sequences, aid in the identification of lymph node involvement for proper treatment planning. These imaging techniques help guide decisions regarding the need for lymph node dissection or targeted therapies. Bone metastases are a common manifestation of advanced prostate cancer, significantly impacting patient prognosis and quality of life. Imaging modalities such as bone scintigraphy, PET imaging with PSMA or sodium fluoride tracers, and MRI help identify and characterize bone metastases. These techniques aid in treatment decisions, including the selection of systemic therapies and the evaluation of treatment response. Image-guided radiation therapy, IGRT, techniques, including daily image guidance and adaptive planning, improve treatment accuracy and spare normal tissues in prostate cancer radiotherapy. Utilizing imaging modalities such as CT, MRI, and cone beam CT, IGRT allows for precise target localization, motion management, and dose optimization. This approach enhances treatment outcomes while minimizing radiation-related toxicity. Recurrent prostate cancer poses challenges in terms of accurate localization and characterization. Advanced imaging techniques, such as multiparametric MRI, PET/CT with PSMA or choline tracers, and novel radiotracers targeting specific molecular pathways, aid in the identification of recurrent disease. These imaging modalities assist in treatment planning by guiding decisions regarding salvage treatments and assessing treatment response. High-risk prostate cancer requires aggressive treatment strategies to achieve optimal outcomes. Multiparametric imaging, including MRI, PET imaging, and advanced MRI techniques, play a vital role in the assessment of tumor extent, evaluation of lymph node involvement, and identification of distant metastases. Accurate staging allows for appropriate treatment selections, incorporating a multimodal approach to improve patient outcomes. Advancements in prostate cancer imaging have revolutionized diagnosis, staging, and management. Prostate MRI with pi-rad scoring localizes and characterizes lesions accurately. Radiomics and radiogenomics provide tumor biology and treatment outcome insights. Imaging guides treatment decision-making, including focal therapy. Molecular imaging and biomarkers evaluate high-risk, recurrent, and metastatic disease. These advancements allow personalized treatment and improved outcomes in prostate cancer.